What is going on, guys? Welcome to another episode of Steph Speaks Radio. Today I have with me Dr. Erin, who I've been waiting for this conversation for a very long time. So why don't you go ahead and tell us a little bit about who you are and what you do before we get started?
A little bit or a lot?
Oh.
I'll just simply say that I am a seeker who asked a lot of questions and was very curious as a child, and as a young woman got a little angry and upset about the misguided information I was getting from my dermatologist and then from my mother's doctors, who misdiagnosed her as a schizophrenic when I was 15. And that kind of bled into some other research with people who were practicing holistic therapies, natural therapies that had studied with the Amish. So I grew up in Fort Wayne, Indiana, and I went to see a fellow who had studied with an Amish elder who had helped him with his cancer.
Okay.
So I was really interested in that. And then I wanted to study like how culture and like through the lens of anthropology is sort of like the first approach that I took to all this world. I was learning about iridology, which is one of the early holistic therapies that came out of the United States as a Western naturopathic practice by a guy named Bernard Jensen. He discovered, or at least amplified, the reality that your iris reflects the entire body, and like it's like a map of the whole body. So just like the ear is, just like people use acupuncture or tongue diagnosis in Chinese medicine, everything's a hologram in this universe. And so that was in the 1920s. This guy knew that, and my older sister bought this book. And I was just like, this is completely fascinating, right? Like you can see a map of the entire body in the iris. So I learned that. And then when I went off to college, I realized I didn't want to be like a lay practitioner. I wanted to be a professional, and I wanted to go do the scientific background to really validate the reality that natural medicine and using herbs and plants and things out of nature in their entirety made more sense than synthesizing one component that they make pharmaceuticals out of.
Absolutely.
So that was sort of my original, like, this makes so much more sense because this is what God gave, nature provided us, and we're part of nature. So is that succinct enough?
No, absolutely. And there's so much, like, this is something that speaks to my core and something that I've grown up around personally. So that's why I'm really excited to have this conversation.
Awesome.
But before we really start getting into the nitty gritty, I just really want you to explain, because some people really don't know. Like when you hear conventional versus like naturopathic, can you just real quick explain the difference before we dive in?
Absolutely.
Yeah.
And I will just point out that I'm really glad you used the word conventional, because a lot of people use the word, they call the conventional medicine traditional. And I'm like, no, we reclaim that. We are the traditional, because our traditions go back hundreds, even thousands of years. We're learning from our mentors, our forebears, and we're also using the science of the conventional Western medicine. But they talk about a standard of care in conventional medicine. They look at all the different studies, and then boards of people get together and they decide for this particular diagnosis, this should be the treatment, especially in cancer and whatnot. What we do is really look at things from a lens of the individual and recognize that you can't always just put a label on a person and then categorize that person. Does that make sense? So like a diagnostic label doesn't necessarily mean that you fit into the same box as every single other person in every single way as that label would imply. And that's one of the most important things I like to emphasize to my patients, because a lot of times people, when they have a mysterious illness, they're seeking, and then they finally get a diagnosis and they think that's an answer somehow. And unfortunately, it really isn't an answer. It might guide you to another of the infinite subspecializations that exist in medicine, but how does that really help you understand who you are in the context of your history and in the context of the symptoms that you're having that are your day-to-day reality that don't come out of a textbook? In our world, the traditions and the holism and the nature-based medicine is so broad sweeping. It's, while we do take from conventional science, we're approaching it as one of a multifold lens. So I have little diagrams and things that I use, graphics that I make, but I have this one particular graphic that I like to bring up a lot, because I believe that we have to take the history of everything humanity has learned throughout the millennia, including mysticism, including what they call empiricism. So it's sort of like natural philosophy before they were doing reductionistic science and sort of chopping everything up into the tiniest of pieces until they got to the quantum. And then they're like, wait a minute, it's the whole again. That whole realm of science, we certainly listen to, heed, utilize. In fact, I believe we use it even more effectively than the standard of care because we can be more nimble without having to go through institutions of boards. We can look at the research ourselves. We can apply it. We can apply it according to our principles. That's really about not harming the individual, like the Hippocratic Oath gave us. Naturopathic doctors take the Hippocratic Oath, this like the really sincere naturopathic doctors take it to the full tilt. So Ohio happens to be a state that we don't have prescribing privileges in. Like if I were in Vermont where my license is, I would be able to prescribe it. I don't even care because I don't need to prescribe. Yeah. Like I have addressed everything from pericarditis, cellulitis, strep throat, kidney infections. We call them outfections. Yeah, they're like healing reactions in our world. I've addressed all of those things that the conventional medical model and the general public believe you have to take an antibiotic for this. And it's not true. Yeah. Because what's really happening is a shift and the microbes are discharging to the exterior. And that has gotten lost in the conventional wisdom, if you want to call it that. Yeah. Like the wisdom in the conventional model is get rid of the symptom at whatever cost without thinking to the future. And that can be problematic.
Well, 100%. I mean, at what point did we stop looking at the root and we just looked at like the weed that formed? Is kind of how I've always looked at it, if you will. And I really like how you even said it's the lens of the individual and it's more than a diagnostic label. I feel like a lot of the times we get told something, whether that be, you know, some sort of illness we have, disease, whatever may have you. And then all of a sudden that just becomes us. Instead of looking at us for us, we get looked as this one thing. And then we get thrown all these different things. And you know what's super funny? A lot of the times I've learned and seen just through, you know, different people in my life, sometimes we go on these different treatments, but then it causes something else.
Exactly.
Something else.
Exactly.
I wonder what your thoughts are on that, actually.
Well, that... I really wish, I don't know if you ever overlay graphics and diagrams on your podcast.
Oh, gosh, I know.
But I have the perfect, it's actually on an article on our website called Principles of Healing, and our website's going to be completely redone very soon, but I actually just sent you a link to it. I texted it to you right as we were starting because I knew that this would come up. It's really a page that I recently rewrote that elucidates the entirety of our therapeutic philosophy. And that therapeutic philosophy is really critical if you don't approach a person with an overarching understanding of how we work within the environment within which we live and within the environment even beyond that and beyond that. You're sort of cutting off your head, if you will. Yeah. So an example of that is we've been using penicillin and all these antibiotics for 100 years or so now, coming up on, and we're finding that people are the microbes develop resistance, and then we have to develop different antibiotics. There's an infection called MRSA, which is methicillin resistant strep, aureus, I believe it is. So these toxic medicines that are toxic to the microbes, and everyone knows at this point in time, you know, probiotic commercials are like wildly available. My daughter was like, look, Mom, they're advertising probiotics. And I'm like, yeah, because, you know, naturopathic doctors have been using probiotics for probably 40, 50 years and understood the whole gut health is the fundamental driver of disease in naturopathic medicine. And we say all disease begins in the gut. So we've understood that concept. But the thing that I'm always trying to reconcile for my patients is if the conventional medical model were really following its own science, they would somehow figure out how to integrate microbiome science with the fact that you can't use an antibiotic without there being collateral damage. And that collateral damage is the thing that they are not integrating from all facets of their science, including metabolic health, mitochondrial science. There's a website called mitotox.org. You can look up and see all of the different pharmaceuticals that kill your mitochondria. Well, your mitochondria, anybody who knows about metabolic health, which is a huge, you know, phrase. I'm sure you talked about that with our friend who introduced us, Michael Cavada. Metabolic health is, going to be the driver of 80 plus diseases when it comes to what happens at the cellular and microbiome level. Because when you're killing your microbiome, you're also killing your mitochondria, and you're slowly killing yourself over time. And it's those various degradations in the tiniest vicissitudes of our biology that are destroying the health at the totality of us. It's hard to see it that way, right? And, well, why does this person have an eye disorder, even though it's a metabolic disease, and this person has cardiovascular disease? Or why does this person have cancer and that person has dementia? And that's really where my personal work and my, what I would call my body of work and my book that I'm writing, it's called Source Medicine, is in like the stage of getting it to a book proposal to a publisher at this point. So we got a little time before that's going to be published. But what I'm really writing about is reconciling that microbiome metabolic science with the emotional and the psychological relationships to disease, and how your body will manifest a disease in a location in your body that symbolically represents your psychological conflicts or your parents or your ancestors' psychological conflicts that are not in your awareness. Does that make sense?
Yes, and I have so many questions right now. And I'm trying, as you're talking, my brain is like, okay, sort out. Yes, because I'm very passionate about this. So, okay, first, gonna touch on different stuff in that, but I'm very into the gut health conversation. So I would love to touch on there for a little bit. And I mean, a lot of people don't know this. I know this. I don't know the exact percentage, but like 70, 80%, maybe more of your immune system lives in your gut. Is that correct?
So the reason people say that is because that's largely where 80% of your lymphatic system is. So in that respect, it's true. It's a statement that's been made. And I would agree in that sense, but I think we need to back up and define what the immune system is. Because it's a very fascinating conversation as well.
Yeah.
The immunology as a subset of medical science actually originated from homeopathic medicine, believe it or not.
Okay.
So I like to direct readers to a fellow named Harris Coulter, Coulter. He is no more, but he wrote a fabulous 4-volume history of medicine that includes holistic medicine and allopathic medicine. So he takes this all the way back to Paracelsus, Hippocrates, and he talks about the vitalists and the rationalists and the difference between the two. And the rationalists are more like the reductionistic folks and the scientific, and not really looking at those relationships, just using drugs that treat symptoms and thinking of the body like a machine or very mechanical. And the vitalists are more like the naturopaths, the homeopaths, the Wim Hofs of the world that understand that the body reacts because it has a vital force. And that vital force is the healing power of nature. If a tree had a telephone line growing through it, it would grow around it, and it would, or if it, had some kind of trauma, it would grow some kind of knob, just the way that when we're cut, we heal and we make a scab, right? This is the healing power of nature. The body will always have a reparative directionality to it. It's so holistic. It's so hard to stay on one track because it's all integrates into itself.
Yeah.
And what we're doing is we're looking at the entirety of it. Just remind me of the original question. I'll get you to where I was going.
Well, just understanding with like the immune system in relation to the gut.
So the immune system, has to do with the gut and all these pieces, but the immune system is really the ability of the body to react, which didn't really exist in allopathic Western medical science. The doctors that were first creating vaccines, even, they were copying homeopathic doctors who were making homeopathic vaccines, meaning they were taking a substance and they were diluting it to the point there was no substance in it, which is what homeopathy essentially is, and potentizing it, meaning it's preserving the vibration, if you will.
Yeah.
And nobody could understand how that worked, so they just called it quackery and disregarded it. But the people who used it had experiences with it that they knew it wasn't quackery. And then what happened in allopathic medicine was they copied that concept, but they didn't dilute it, and they started giving people vaccines that still had the toxic virus or other adjuvants in it, which then ended up becoming suppressive, meaning it stopped the elimination process in an individual. So vaccines work in that way, but they don't look at what other diseases might be created ensuing down the road, chronological, because nobody's ever looked at that science.
Yeah.
That research has never been done. So the immune system concept came out of homeopathy. So that's a big trajectory to follow that I was on. No wonder I lost my own train of thought. But it's all about the vitalists and the way the human body reacts. So immunology is literally about the science of the reactions through signaling. But if you look at the immune system on a more larger level, the immune system is differentiating me from my environment, me from you. And that is critical because it really has to do with more of the psychological history of humanity and Carl Jung's work, which is all about individuation.
Yeah.
As a child grows up, the child learns what their emotions are because the parent mirrors to the child what they're feeling. The parent mirrors to the child what's appropriate, what isn't appropriate. In most families, there have been some degree of boundary blurring, we know. Everybody talks about boundaries. We talk about boundary violations. We talk about trauma. We talk about assault. This is where people's immune systems actually get very confused. So autoimmunity, there's almost always some degree of trauma in that person's family history of a certain nature. There was a lack of boundaries. The boundary may have not been that person learning who they were because the parent didn't reflect to them properly, or the boundary violation may have been of a physical or a emotional abusive or sexual abuse nature, or, really any kind of trauma. But those are the ones that are mostly associated with autoimmunity. Does that make sense?
And you were saying, just so people can thoroughly listen and understand and be able to speak to them in a way that they're listening, okay, I can see if I can draw maybe a connection in my own life or people around me in some sort of way. Because you were saying with metabolic science, outside of just the gut health and this whole conversation, also just the emotional, mental, all of these things. And, I've always been that big advocate of the body keeps the score, if you will.
Yeah. I love Bessel van der Kolk.
Oh yeah. I'm like, you probably know that book, but
absolutely. I met him a couple years ago at a conference. Yeah.
Well, that's the thing. And it's just and that's such a wildly deep conversation, but it's just really that thing of our body is keeping the score of everything in our life, whether that be our own stuff and our own trauma, generational trauma, the layers, and the willingness then to how do we go in and then create the breakthrough of those things. But our body carries this weight on us. And I've been an advocate of someone I bring this up in so many conversations, but I want to bring it up to you because I think you'll find this probably not interesting, but also you're probably okay, that makes sense. I was under extreme stress a year ago. It wasn't just physical burnout with my job. I mean, I do work a lot. It was also some personal stuff in my life at the time, mentally, emotionally, all these things, physically, everything in my body was under stress. Okay. And I ended up getting shingles, horrible case of it. And I remember sitting in the urgent care and they were like, oh no, it can't be shingles. That makes no sense for you. I was like, are you sure about that? Well, ended up being shingles. And it was interesting because the therapist I was working at the time, she's like, well, of course you probably got shingles because look how much stress your body is under. And it was an interesting time for me at that point because I was like, the reaction that my body had to the stress that I was under because I wasn't choosing to deal with it. And then it ended up coming to the surface because I wasn't digging to the root.
Yep. So you basically just explained the entirety of everything I just said, right? So
okay, so let's this is an example. Okay,
let's unpack that a little bit.
Yeah,
so
cool. Yeah.
The first thing I would say, so I talked about the importance of feeling in the healing process, and you literally just said I didn't want to deal with it, so my body manifested it. So that's the manifestation of what I tell my patients when they try to say I have all this stress. So that's kind of like an outlawed word with Dr. Erin because when somebody says stress, I've just even in the last 2 months started saying stress literally means nothing but an experience that I do not want to have.
I like that.
That word was coined in the 50s. It didn't even exist in the human language before Hans Selye coined that word, stress. What does stress mean? We think about stress on a metal. If you bend it too much, it'll break. Right. You think of stress on a bough, on a tree, it will break. Stress is, the tension we feel in our necks when we're stressed is really the refusal to feel. What pressure, what burden, what emotions you're having that you just can't tolerate. Or perhaps it's a reality that you cannot accept, right? I don't like this. I don't want this to happen. I am stressed. But what the hell does that mean?
Right.
What you really have to do, I believe, is you have to dive into what's the feeling behind this? What am I avoiding? What am I not accepting? If you accept your reality, things get a lot easier, first off. But people, they sometimes don't because they're in fear. Well, if you're not accepting because you're in fear, you got to recognize that you're in fear and allow yourself to feel your fear. And I can guarantee you that if you don't do those things, very simple things, your body will show you.
And I was going to ask you, what could someone expect? Maybe there's someone listening that went through, and there's different layers of the depths of the things we go through. But say someone went through something pretty traumatic for them, like something where the body, we kind of block it out, if you will. If someone, like I say, refuses or chooses not to deal with these things or to, open them up for them to heal, what might we expect to see as a result of that over like years and years of suppression of these things?
So it really is going to vary depending on how you deal with whatever physical symptoms manifest. So if you have physical symptoms manifesting, it may just be that they continue to manifest. They don't go away. But in most cases, people are reaching to over-the-counter chemicals. They're reaching to vaccinations, steroids, antibiotics, whatever the case may be. The more what we call suppressive interventions there are, the more you're literally breaking down your lower biology, as I mentioned already.
Right.
And then the more you're layer caking your disease process to deeper and deeper parts of your being. Meaning, I use myself as an example in this case a lot because part of my journey, I mentioned my dermatologist earlier, has been skin rashes and skin eruptions. And it's like something I still deal with. Yeah. But it's because I choose not to suppress it because it's my personal barometer. Right. Of course, I know suppressing it is horrible. And that's, part of what happened when I was a kid, when I was given steroid creams and vaccines and antibiotics. And that's, part of the reason why I'm still dealing with some of that today. But I think even more so is, it has to do with not being in a coherent state 100% of the time, which is very difficult for all of us to do. We live in a toxic world. We live in a world where we live on computers and cell phones, which, just looking at blue light kills your mitochondria. So it's like, and then we have the stress, and then we have all the things we have to do, and right? So there's a lot going on. And the more you're aware of what your body does when you're having one of these experiences that we don't want to have. So when we feel overwhelmed, when we feel resistance to thinking and feeling, or even stopping and getting quiet, right? Or if we're not sleeping well, like all these things can contribute to what we call stress that then creates physical symptoms. The more you have those things going on, the more your symptoms will manifest. But if you take drugs, or say I just put steroid cream all over my skin, I'd probably develop allergies or I would develop asthma. So, this is another overlap from conventional medicine. They recognize what they call the atopic triad. Okay. Skin, lungs, allergies, asthma, and eczema go together. Okay. Because what happens with most children is they'll get steroids and then they end up having asthma or they end up having hay fever. Okay. And often those symptoms will jump back and forth between the same person, depending on the level of suppression that's been there. So I used to have hay fever, but I don't have hay fever anymore because I treated my gut enough so that it just maintains at the level of the skin. But I can't consider the skin a negative thing because I kind of fundamentally know I'm never going to have heart disease and cancer because my body is discharging to the exterior in a positive way. And that's in homeopathy. We know that's one of the healthiest and one of the most surface level types of eruption that you can have. Does that make sense?
Explain what you mean by that.
Well, it's a little bit deeper into the history and the philosophy of homeopathy. But in homeopathy, the fellow who coined that term and created that method, his name was Samuel Hahnemann. And he, in his later life, he went into researching why are some diseases so easy to just resolve it with one or two remedies, and other diseases it's like you got to keep working with the homeopathic remedies. You have to treat them for a longer period of time, and it's almost like the case is a deeper level of disease. So he developed this concept called miasms, and in France they call that diathesis. It really has to do with the transgenerational patterns and more of the temperament and more of the deeper behavior of a person.
Mm-hmm.
So temperament and diathesis is a little bit different, but that
Yeah.
I digress. But it really has to do with just like these deeper, more complex layers of chronic issues.
Mm-hmm.
And in naturopathic medicine, homeopathic medicine, we really differentiate the difference between acute and chronic because it's generally the suppression of acute that creates the chronic.
So the suppression
of acute illnesses. So like runny nose, hay fever, acute colds, the things that people take antibiotics for generally.
Okay, got you.
Or that they would use steroids for because
Yeah.
it's like there's all this inflammation we got to get going on. We have to get rid of it immediately. I'm suffering. I can't tolerate this. How long can I have this? What if I have a systemic infection? Blah, 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 blah. They get very freaked out if their symptoms are severe, if they go on for too long, and then they think I have to take an antibiotic. And I call BS on that because you do not. You do not. What it means is your organs of elimination are blocked and overwhelmed, and they need to be supported better so the process will complete sooner. That's what it means. Or you've suppressed enough in the past that it can't quite overcome this, and you need a little robust support. That's what we do at Options.
Yeah.
Options Naturopathic, my business.
Yes.
Cleveland Heights that I've had for 25 years.
Yeah.
This is literally what we try to teach people how to do, and we have resources, instructions, handouts for literally anything and everything so that people can avoid ibuprofen, Tylenol, antibiotics, eye drops, everything from newborns to crossing over at the end of life. We've got everything that facilitates that process so that you're not suppressing, and ultimately you're learning and you're expanding your awareness around your body and your being.
Yeah. And it's something I've noticed a lot and I mean, just at least from my experience, like in our culture of how we do things over here. And as someone that, I grew up in a Greek American family, I go back to Greece quite often. I'm actually leaving in a few weeks. So I've really grown up around that, right? And just like a different lifestyle and way of healing of different culture compared to how we do it here, like in the States. And just like, I see it all the time whenever something's wrong. All right, let me pop this pill. This will fix it, this, that, and the other. And, growing up, my grandfather had always said to me, I just remember being like 5 and him saying, the whole quote of like, let food be thy medicine, and always thinking of things from this perspective. And I don't know at what point where it got lost in our world over here for a lot of people, but I don't know. I've really just noticed like how we are as like a system here compared to maybe some other places. It is very different from my experience, at least from what I've observed too.
Yeah. I mean, in terms of where it got lost, I think it happened. It was a slow climb over time. That divide has always been there. That's what Harris Coulter wrote about his books, in fact, are called Divided Legacy.
Oh, there's a book
and
on
it talks about the advent of the American Medical Association. I mean, a lot of it was really market share and then the capitalist nature in medicine. I mean, think about it. What if somebody takes an antibiotic and all their symptoms go away? They think they're good for the moment.
Right.
And we had to really develop the science of even understanding that there is a microbiome. Right? Like we didn't know when the first time they looked and saw microbes in us, they were like, ah. And then they started seeing the same forms in the same circumstances. And then they thought that it was the microbe that caused the disease. Yeah. But we would say, no, that's not how it works. It's the circumstances and the landscape, what we call the terrain in the body, the landscape and the internal milieu of the body that then creates the environment for the microbes to shift into that form. People call this germ theory versus terrain theory. And I say that germ theory really lives inside of the terrain. So the germs shapeshift based on the circumstances of the environment. And that's another huge divergence from classical science, because while there have been multiple researchers throughout the last probably 150 years that have come up and overlapped with that concept of more of a shape-shifting microbial world, the conventional model completely doesn't really see that and understand it. There's a few things where they see like a cycling, like syphilis or like other spirochetal diseases like, Lyme and whatnot. But our approach to this is recognizing that when you address the landscape and the field, it much more supports what your immune system can do in terms of shifting. And it's again, that environment tucked inside of another environment, tucked inside of another larger environment that recognizes that we are holistic systems that are taking in information and exporting information in order to upshift the consciousness of which we are.
Something I'm curious about talking to you about too, just from the, obviously, we're females, and I know you obviously understand the female body right here. And as we're talking about all these different things of the body and like your viewpoint, I just really want to touch on from like female physiology, because that's my job and I work with women all day. And I'm just curious on like, we're seeing so much, I don't know, I can't think of any other than just like issues and navigation of different hurdles for like female health, longevity, hormone health. I'm at the highest. Okay. So when people apply to work with me, they have to fill out a form. Okay. And I ask all these questions about their health, their background, yada, 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 before they come to train with me. The amount I see things like PCOS, endometriosis, Hashimoto's, thyroid. I mean, more
it's unbelievable
in the ages of about, I'd say 20 to 40.
Can I unpack it?
Well, yes. And another thing too, and if you don't mind going into it, if you feel comfortable, also like, with birth control nowadays and all these different things. I really want to hear what you have to say about that, because so many women come to me, and I have girls that have been on birth control easily for 15 plus years. I had one girl get off of it, and then she just realized for 15 years she was covering PCOS and had no idea until she got off of it.
So this is a topic that's very near and dear to my heart.
I love this conversation.
So like 5 more podcasts.
Unpack it, girl, because I want to.
But I should say that I'm launching something called Co-Creative Consciousness Circles, and it's meant to be really like Q&A with Dr. Erin from a metaphysical perspective. So ladies, please come join. We don't have it fully dialed in on the back end yet, but you can join our newsletter, and then when you can join that specific newsletter on my website under that page, Co-Creative Consciousness Circles. It's a long name. We can call it Tri-C, but in any event, PCOS, hormones, women, so much to say. Where do we begin? First of all, on a metaphysical level, understand that we have our nervous system and then we have our endocrine system.
Yes, yeah.
So the nervous system and the endocrine system are linked through little molecules that we call catecholamines. They're sort of like mini hormones, if you will. Neuroendocrine signaling is also the hormones that we secrete, right? The nervous system senses, the endocrine system feels. They're interlinked through the nerves and through the chemical signaling molecules I was just talking about. When we take exogenous hormones that were made to control our menstrual cycles, we are automatically disconnecting ourselves from the cycle of nature.
Okay.
The rhythm that we hold of being a human being on a planet that spins around the sun, that's got a little moon that pulls our waters, right? Every lunar cycle, a woman should be having a cycle when she's in the reproductive years. So when we take birth control pills, we override what's going on. So that is definitely one layer of suppression. And unfortunately, they're putting young women on these pills when they get their menstrual cycles and they don't have regular cycles, or they have really heavy periods, or they have acne, or they don't have a period. It is the most egregious thing that is happening in one of the most egregious things, and one of the crimes against women, if you ask me. And this even goes for birth control that's taken for birth control. Yeah. Because you're still doing the same thing, even if it's not a medical reason. But it's become the thing that the conventional world has landed on. And these young women don't understand that they're taking petrochemical, synthetically derived chemicals, number one, that are totally overwhelming their livers in time, let alone the disconnection from who you really are as a conscious being, because now I have no relationship to my sun and my moon and my stars because I'm yoked to the pharmaceutical industry through my petrochemical I take every day. Yeah. What do I do? I don't want to get pregnant. It's like you have to think about yourself, your future health, and the health of your child. And I can guarantee you that what you're creating is a miasm, a chronic disease, where you're training your body how to not eliminate to the exterior when you do this. Does that make sense? You're overwhelming your liver. You're teaching your body, don't eliminate. Even some women don't even have menstrual cycles anymore because of the hormones they take. Really? It completely shuts down their cycles. Some of the IUDs do this, that have progesterone in them. Those are also bad. Yeah. Bad. I don't like to necessarily quantify things as good and bad. There's a spectrum in everything we do. And in fact, there's a spectrum of suppressive hormones you can take with synthetic oral corticosteroids as the worst, because your body can't not respond to that. It's such a powerful chemical that's a signaling molecule that really should be part of how your body speaks to itself internally. That's what those molecules are meant to be.
Yeah.
My mentor called them sacred secretions because they're in very tiny doses. They do a lot of work, just the way in very tiny doses the plastics and the toxicants that are endocrine disruptors do really bad work on our lower level of physiology, meaning the enzymatic systems and the detox systems get totally blocked up. And then we also get this hormonal stimulation that drives us down the wrong path. So you mentioned endometriosis, you mentioned PCOS. Did you mention anything else?
I mean,
menstrual cramps. I mean,
Hashimoto's PMDD.
PMDD.
I
all
have
these things.
That. I'm pretty sure. To be
so
honest.
all of these things are things that are kind of a layer caking of everything I've already talked about.
Yeah.
You have gastrointestinal permeability and gastrointestinal issues that then drive additional toxicity from the gut that's endogenously created that the liver also has to deal with. So I've actually realized later in my career that PMS, PMDD, endometriosis, it's all liver overload. Liver.
So
I'm giving you like the keys to the kingdom here, baby. Like this stuff is like.
Well, this is, and here's the thing, and I know because I know a lot of people are probably like listening, and I know the average person are like, I am confused. I do not understand what the hell you guys are talking about.
Yeah.
So like, if someone's hearing this with the liver overload, like, where does someone?
What do you do about it?
Literally, yeah. Like it's like, and think about it like this. It's like there's so much out there now about like I do know because I do see it. There is a lot of awareness now on things being endocrine disruptors, and women are having a little bit more of an understanding of things that might be more harmful compared to others. But then it can be overwhelming when someone starts like looking into that. Okay, I have to replace everything. Like, what do I do? Everything's bad for me, yada, yada, yada. And people get overwhelmed. So that's a real question. Like realistically, like where can women start that, whether they already have these going on or they want to be in a prevention state? Like, what do we do?
Well, there's so many approaches a person could take, and there's no wrong or right. But what I have created over the course of my career is an organization that essentially educates people and then puts matters into your hand. That's literally the core competency of Options Naturopathic. So what we're literally about to launch is a new type of onboarding that takes every patient through the same journey, but only goes deep and broad for the people that have the really serious chronic diseases. And if you just have a little issue, you can come in for a quick visit, and then you can join a low-cost membership that will give you access to what you need. Now, you can come back and work with us as much as you want because you might have the need for more understanding. You might have the need for some more mental emotional support. You might have the need to unpack some historic traumas, which are all things that I personally go into very deeply. But I have other naturopathic doctors that work for Options, and we will also assess blood work. We will assess your whole life history. We will assess your family history and really put it in a context for you, and then teach you how to deal with acute issues yourself. And that's what that onboarding process does. It's sort of like assessing every person. How deep do we need to go? What do you need to fully resolve these issues? And we teach you that yourself. We teach you how to read your own blood work in a way that even the medical doctors don't really utilize. I didn't even learn it myself in school. I learned it from Dr. Nasha Winters, who I sought out about 10 years ago because when I got to cancer patients, it was so complex and such a cluster of varying causative issues. I really needed another layer of mentorship there. And so Nasha is another naturopathic doctor who had stage 4 ovarian cancer. And so that's how I ended up working, and my company started working more specifically with a deep dive, broad reaching approaches when it comes to more serious illnesses like cancer. So we have like a really deep, broad process. While of course I would love for people to use this organization that is specifically designed to do all of the things we're talking about here today, I don't want to imply that that's the only way you can do it. One thing I would just say about my own experience in the endocrine female reproductive sort of issues that people have, it's like, we've got some bundles on our shop that are great for the gut. We have some stuff for women in terms of the various problems, and homeopathy and the way that we use complex homeopathy that is not just classical homeopathy. Again, a whole nother podcast episode to explain the differences there. But these are really some of the things that I think are really powerful, because a lot of times it's about regulating that lost rhythm. And a lot of times when young women aren't having their periods in a regular rhythm when they first start, or it's too heavy, it also has to do with trauma that happened before puberty. And that's one of my another issue near and dear to my heart, because we work so much in the chronological and historical. I'm helping patients understand how to recorrect and recohere their own endocrine system as it relates to the organs and the neural tissues. So this is an optimal maturation program, we call it. It's the work of my mentor that we made really simple for people to be able to do. You don't have to be a patient of ours. And soon I'm going to be launching a course for other practitioners on learning how to do that, because it's something that is clearly needed with all of these issues of women taking birth control, young women being put on birth control the minute they hit puberty. It's just, it's absolutely scandalous from my perspective, because I'm seeing the relationship with the people 10, 20, 30, 40 years out when they're getting cancer diagnoses and, things that are very hard to bear out in the scientific meta data. But we see it when you look at it from the therapeutic philosophy, and you look at the patterns of the kinds of illnesses that people have after they've taken birth control pills for a long time. For example, one would be sinus infections and or urinary tract or yeast infections. Those are things that happen after in many women who are blocked in their elimination after taking birth control pills for a long time. So that's something to watch out for. Like if you see that pattern in yourself, your liver's overloaded. And
what are other symptoms of liver being overloaded besides that?
Oh my God, just about. There's
common ones, I guess.
So many, but heavy periods, endometriosis, fibroids, definitely inability to detox other things. You can have all the PMS and PMDD symptoms like mood. Really, liver is associated with anger. So having irritability, getting your period and being, weepy and crying, and then blowing your gasket at the next minute, right? These all have to do with these disharmony between the different organs too. So it usually, in this world, even though we talk about the liver, it's always in the context of how does it relate to the lungs, the heart, the spleen. We look at things from the perspective of Chinese medicine, 5-element theory, all of that too.
Now, okay, 2 different questions. Question 1, I know there could be someone listening or someone sees, because we do hear about liver detoxification, stuff like that. And there's all these different supplements out there. So I know some people want that quick fix. They might just go online. And what are your thoughts on someone just going and buying, this is like a liver detoxifying tincture or a supplement? Does that actually do anything? Well, if we just buy one supplement.
I have to say that in this day and age, I have been in practice for 27 years, and I launched my own shop probably in 2009, I think it was. The amount of stuff that's on the market these days that compared to where it was when I graduated naturopathic school in 98, when they were teaching us how to make our own tinctures and stuff, and then it okay, that got very overwhelming. There are so many things, but we do have some. Right. If you go right on our shop, we have our main website, you click on shop, you go in our apothecary. On the first page, it gives you some really good information about what to look for quality supplements. Liver detox programs, most of them I'm not really a fan of. They can either be too aggressive, they can be too many ingredients in one product. You just really want to, I really like the individualized and the homeopathic approach there more, because it's just gentler, and it's more about retraining your body how to eliminate than it is to go in and do a colon cleanse or a liver purge or drink a bunch of olive oil and then think you're passing gallbladder stones, which usually most of the time when those are taken to a lab, they're not actually gallbladder stones. They're just little emulsified balls of olive oil because your gallbladder's working.
Yeah.
So we really just like to individualize exactly what the person needs, right? And sometimes a liver detox isn't what's needed as much as it is re-entraining the liver to what it should be doing, recognizing the body needs to release, or maybe it's even healing the gut because it could be coming from inside, or training the person how to not use X, Y, and Z because they're compromising the liver. Just every once in a while I take an ibuprofen for my migraine, or I take a Tylenol. It's like, let's find different tools, because even though it's just a little bit, Tylenol is actually hepatotoxic. Like, why in the world would we want to treat a problem that originates in the liver with something that's actually toxic to the liver?
Yeah.
So it's just about finding those other tools and understanding the holistic context rather than that quick fix. Let me buy this liver cleanse online because she said liver on the podcast, right? And it, again, this is really where we're going with Options Naturopathic. I dropped the word clinic. I'm moving in the direction of creating a kind of repository of information that anybody can access, so that once they learn the basics, they can go get and use what they need.
Yeah.
Because we're trying to co-create a new culture of healthcare overall that's really about healing. Is not about just get rid of my symptoms and have that quick fix and not think about the future implications of what choice I'm making in the now, even when I'm desperate and I'm, I'll give you an example. We had an unfortunate accident, and my husband's cornea got scratched last night. And he went, I was like, you got to go see the doctor because this could be bad.
Yeah.
It was searing pain. And then when he called me after he went to the doctor, the phone wasn't working right. He couldn't hear what I'm saying. And he was like, he gave me some drops. And I was trying to say, don't go fill the prescription, whatever it is. Like, let me talk to the doctor, find out what it is. Because I didn't want him taking steroid drops in his eye.
Yeah.
Because steroids will have a systemic effect. It will impact your blood sugar, even if it's a drop in the eye. The doctors say, oh, it doesn't do that. Let me tell you, we're checking people's blood sugars and their ketone levels throughout the day. It is impacting your blood sugar. So one thing, we didn't want him to do that. And steroids, what did I say about steroids already, right? Mm-hmm. So what we would rather do is give the body the information it needs to heal an acute trauma, a laceration. So this is antioxidants, this is anti-inflammatories. These are, things you take orally, homeopathics, drops we'll put in the eye that will, I can guarantee you, we'll treat him for a week and he'll go back into the doctor and the doctor will say, I have never seen anything heal like this ever in my life. Yeah. Happens all the time. Right. We have surgical protocols and people go get surgery and we give them, if they do our full surgical protocol that we've been revamping for 27 years, you can't even believe what happens. Yeah. And no one knows this other than my patients. So thank you for hosting me on your podcast.
Well, because it's not the commonality for people to go look that way.
And then it's also like people unless they know me, they wouldn't necessarily think to spend, 50, 100, 200, 250 bucks on a surgical protocol. But if it shortens your healing time when you get a hip replacement down to a couple of weeks instead of 6.
Yeah.
This is like life-changing stuff. And not only that, you got all these additional benefits because you didn't toxify your liver and kill your microbiome in the process.
Yeah.
So.
Yeah. It's just been so much going on that I've been like watching from the sidelines, like in, my own life with my family and different things. And so I've just been so into the proactive instead of reactive approach. Like I said to you on the phone, I feel like we wait for something bad to happen. Then when it does, what do? We panic. Then we go do whatever the quote unquote XYZ doctor says and tells us to take this, that, and the other. And then here we go. Right. And I've been watching from the sidelines as, my grandfather recently has had a double whammy of not just lymphoma. He also has dementia. And I've been watching this from the sidelines.
It's rough.
And, I don't mind publicly sharing about it. It's been pretty rough watching him get hit with both. Hear that. And it's just this
painful.
Yeah. And it's like, every day lately since it's happened, I can't lie to you. I have this fear of, oh my God, is that going to happen to me? Because his mom also had Alzheimer's dementia. Then he did. And then it's like, on my mom's side of the family, I have witnessed a lot of mental health stuff going on, if you will. And there's been a lot of suppression, a lot of people not dealing with stuff. And, I know he had a lot in his life. And then it's like, I watch from the back end and I'm like, I can't help but wonder, did a lot of this manifest in the body because of, one, not dealing for so many years with so many things, never looking at your perspective of things of healing, right? Going more the conventional with everything in life. And then also I look at their pantry, I see types of food. I look at this as a whole and it's very, they even say now, like, I know you've obviously heard this, they'll now call even dementia, Alzheimer's, like type 3 diabetes, like everything starts with all these different things. So it's like, how do we now, and I bet there's people that see like maybe someone in their life having cancer or dementia, and they're scared they're younger. So it's like, for those people that are scared, I'm one of them.
Yep.
It's like,
what do I do
for proactiveness? I mean, obviously I'm a trainer, I'm in the gym. I'm going to say obviously exercise, but I mean, like, you know, of course.
Well, let me just say that, you know, when you first opened this question, one of the first words in the first one or two sentences you said was panic.
Oh, for sure.
So let's just start there. You were wanting me to talk about things that people can do.
Yeah.
Lifestyle changes that they can make.
Of course.
What are the most important things to start to institute changes from a natural health lifestyle?
Mm-hmm.
So I really thought of 4 things that are really fundamental.
Okay.
Really, it's like 2 things that become 4 things. So we have stillness and movement, and we have feeling and mental regulation. So the stillness can go into the feeling and mental regulation.
Yeah.
Because it's like you don't know what you're feeling until you stop and get still and reflect.
Right.
And then I'm a big fan of heartfulness meditation. I'm a trainer as well. Been doing that for a long time. Yeah. And what that system teaches you to do is how to regulate your mind so that your thoughts aren't taking over and you have more self-awareness. Okay. Mm-hmm. With that self-awareness, pause, stillness, you then get good sleep, which is one of the other 3 things I was going to mention.
Oh, well, of course. Yeah.
Right?
Yeah.
So sleep, movement, feeling, regulation of the mind. Mm-hmm. If those 4 fundamental things we're doing, we're allowing for there to be a coherence where we're bringing the mind into the heart instead of just intellect has all the answers. It's like we're moving more into an intuitive feeling mindset, which I think has been completely disregarded throughout history. Part of the reason why the conventional model got to be where it is today. It's like the anecdote has no meaning. You know, your experience doesn't matter, mother who just got your MMR and your child now has autism. It's like, no, my experience and what I witness has all the meaning in the world. And I reclaim that proudly after practicing naturopathic medicine for 27 years. It's like, we have to honor our own experience and the experience of the mothers and our patients that come in and tell us, I'm having this experience.
Yeah. I mean, it's...
So when you get worried about the future potential thing that's coming down the family pike of your transgenerational traumas and your health history and the doctor telling you it's a genetic or a familial problem, realize that that problem was certainly created in its habit through the mental thoughts and fears and the stress of the parent, grandparent, and you know, greater ancestors where they were avoiding and they weren't feeling and they were doing what they could with the resources they had. We're in an era now where we have more resource and more awareness to attend to the feeling states. So we got to breathe. We got to slow down the panic. And you're already doing it, Stephanie. I mean, you're doing this podcast. Right, you're talking to people like me. You're having other guests on. You're learning about all these things. You're slowly going through your pantry and the stuff under your sink and your makeup and everything you put on your skin. And you're going, okay, what's going to disrupt my endocrine system? I was totally stressed out. I had shingles. What do I need to feel? Like, you know, there's no avoiding what the reality is. It's just you're facing it. Now, the people who don't want to face their reality, these are the people that get cancer and dementia and 100%. Cardiovascular disease and all the other things and that's just how it is. And 100%. So you either accept it and you look at it or you barrel on and suppress it and keep going. I mean, I'll admit, my sister and her family were in town this past weekend. Did I end up at Mitchell's Ice Cream with my children and the family? Right. Did I want to say no because I knew I'd want to eat Mitchell's Ice Cream? God bless you, Mike Mitchell and your brother.
Right.
But another local business owner here. Yeah. But I mean, I love that ice cream and I ate it and I suffered for it. You know, it's one of the things that makes my skin flare up because I have a little bit of an elimination after that. And of course, you know, it also has to do with my metabolic health. Yeah. So I pay the price. I decide when to pay the price and I try to avoid the things that are costing me my optimal health. And I try not to be neurotic about it, but I know everybody I know thinks that I'm like some, you know, they come to me like I'm a priest and they're going to confess. And I'm like, there's nothing to confess here. Like we all make our choices, but we have to live with our choices. And being in denial doesn't mean that you don't have consequences that you or your loved ones are going to have to deal with. And it's really painful to watch people make those choices. But I've gotten to a point in my life where I'm like, each individual, I watch my family members, and if it's somebody that I know I'm going to be directly impacted because I'm going to have to take care of them, then I let them know how I feel, and I let them know that I don't think it's fair to me, because I believe that's part of boundary setting, as I was talking about earlier. But it's not always easy to do that, like we're here, like I'm human, I'm living in a family, I've got relationships, and we're all trying to navigate and find our way, and we're all trying to clear what we got from our parents. When you first started talking, I, again, thought of Carl Jung, because one of his sort of core central tenets is that what doesn't come in my awareness it becomes my destiny. And I believe that it is my fate, but it's not true. If you bring what's in your subconscious into your conscious, or what's being carried in the body into your awareness, you can change your destiny. Yeah. It's only when you deny it that it becomes something that's dictating your life and what's happening, and you're just thinking, I don't have free will here, and I don't believe that one bit.
That was a powerful thing. I think that's kind of how I want to wrap up, because I think having people have that understanding, that empowering thought to themselves of I can change my circumstance. I do have that power. There are tools, there are things available, and I don't have to stay, back to the beginning where you said these labels thrown on people, right? Different things. And that could be a medical label. That could be just a label we impose on ourselves. That could be that's a whole other deeper from the mental emotional standpoint of the labels we put on ourselves from other people growing up, XYZ, whatever may have you. And so I just think being able to close off on that, just, how you said, we do have the free will to make those changes in our life, but a lot of people think they don't. It's here's a lock, throw away the key. But that key's in their back pocket. We just don't even think to go grab it. We just take it it's almost like we're putting our hands out to everyone else. Who can help me here? But you have so much power within you. And I think a lot of the things that you do is you remind people of that power within them.
Definitely.
And you help the body come back.
Just to kind of close it out here, and again, we can always come back and have another conversation if you want to unpack any of this further. But one of the things I would leave people with in that mindset is be aware of when you're in victim mentality. Yeah. Because the reality is actually that you're creating the reality that you're expecting to see. Yeah. Based on what you've experienced, based on your own experiences and your family history, you're expecting a certain thing. Right. And if you were trained to be a victim by your parents or whoever was in your environment as you were growing up, you will approach the world like a victim. But if you look at the neuroscience of what the brain is doing, the brain is actually a predictive device, meaning it's putting out there what it's expecting to see. And energetically, we're resonating with what's in the infinite fractal universe with that which is on the same coherence and vibratory level as us. You're in a field of coherence. If you change your vibration, you change what's happening to you. So you can do that through multiple avenues, but being open to the fact that you have that power is the greatest responsibility anyone will ever help you to understand that you have, right? We all have that. That's part of the disconnect in the conventional model, is that it's much more of a victim mindset. So, there's a lot of other rabbit holes we could go down that we don't have time for here. But I know. I mean, I tell people, go watch Anil Seth's TED Talk. Yeah. He's a neuroscientist who explains this concept of the predictive nature of the brain. And then you start to think, well, what? And then there's all these other people that he's connected to that you can listen to. But this is the kind of stuff that I'll be tying together in my circles for people, because I want to teach people how to do these practices and concepts so that they can consciously co-create their own physical, mental, and emotional reality.
Definitely. I mean, this was awesome. I mean, there's so much I want to go into, and I know that we could keep going. And, for anyone that's listening right now, if there are more questions that come up, I would love if people let us know. We can come back for another conversation.
I'd love it.
Dig deeper on this. I know that this could open up so many. So if you're open to it down the road, I would love to have you again.
This is fun. I love doing this.
I know we could go all day. I was
getting the voice, getting to talk about all my life work, and I think about constantly, and getting to share it with people. And
Yeah.
We really haven't had our marketing dialed in at all, but
Yeah.
we're going to be
Yeah.
doing that soon. And I
Awesome.
got this book coming out, so
Oh, yeah.
I'm so grateful for the
Oh,
opportunities.
well, I'm excited to read
Thank
your
you.
book. Thank you.